Good morning and happy Monday. I hope everyone had a safe and good weekend. Today starts chapter 5, and remember we're nearing the end of this module. So please make sure that you get in contact with me if you're in need of assignments that need to be reopened, if you missed an exam or any other difficulties you've had with your labs or with your daily assignments. Please email, text, or give me a call so that I can reopen those assignments before the module ends. Remember, every Thursday for 4 p.m. is your Zoom class. Every Tuesday for 2 p.m. is your NCCT certification practice exam and testing. So please try to log on. Remember, if you're unable to attend, it is placed in the NCCT Grace section of e-learning labeled NCCT. And your Zoom class is also recorded and placed in the Zoom class in your e-learning Grace section. Remember to check your emails daily, check your news and announcements daily when you log on and before you log off for the night. So we're going to go ahead and get started. I'm going to share my screen. This is your 5-minute video that we're going to be going through. And it's just to give you a brief little clarity on some of your information that you're covering. So today, chapter 5, clinical use of the electronic health record. The objectives that will be covered in this section is describe the benefits of documentation in the electronic health record. EHR is the electronic health record. Explain the role of speech recognition software in medical documentation and describe its benefits. Discuss documenting remote patient-provider encounters, including telehealth. List the 8 types of patient encounters. Describe how to document allergies and discuss the components of a patient history. So we're going to go through these 4 really, really fast, and then just to give you a quick little review. So remember, as I stated before, your PowerPoint slides are very helpful. This information covers mostly everything on your exam and to assist you with your daily assignment in labs. Documentation in the electronic health record. This is one of your daily question assignments. So documentation in the electronic health record makes diagnosis and treatment more efficient, promotes patient safety and reduces medical errors, serve as a risk management function by providing evidence of communication, provides evidence of care delivery. Proper documentation in EHR allows related items such as health history, progress notes, patient letters, and patient instructions to be linked. Voice recognition allows the user to work hands-free, eliminates the problem of misplaced or misfiled patient notes, decrease the rate of transcription mistakes, lower the cost of transcription, reduces the amount of time necessary to complete documentation, increases the overall quality of patient care. Documenting remote patient-provider encounters, telephone documentation, medication refills, sick calls, patient treatment questions, telehealth e-visits, web visit or online consultation, monitoring chronic disease, not for new patients, HIPAA-compliant online connection, visit must be documented, define time period for e-visit. Clinical documentation in the patient record. In SimChart for the medical office, which is SCMO, the patient visit is called an encounter. So remember, in clinical documentation in SCMO, the patient visit is called an encounter. Clinical staff members records patient's height, weight, patient's vital signs, blood pressure, temperature, pulse, and respiration rate. Patient encounter, annual examination, comprehensive visit, follow-up established visit, new patient visit, urgent visit, wellness examination, 6-month visit, phone encounter. Allergies. You document the allergies in the encounter: environmental, seasonal, contact, food. Verify every visit. Document corresponding reactions. So if we go to the book and we go to chapter 5, which starts on page 85 in your ebook, remember, make sure you know your key terms. And then when they give you the exercises, and it gives you all of this information here in the book, but like I said, it's much easier when you look at the PowerPoint slides. It breaks it down for you. Make sure you read your trends and applications. So 5.1, it gives tips for exceptional documentation in the electronic health record. Composition instructors are fond of reminding students that poor writing rarely masks a brilliant insight lying just below the surface. On the contrary, jumbled sentences probably indicate muddled thinking. Clarify your ideas and your writing will shine. Likewise, excellent documentation and high quality care are closely related. Jurists leap to conclusions about physicians whose records are sketchy, and for good reason, because it is probably true. Good documentation prevents many errors and shows evidence of quality care. Here are some tips to improve provider and medical assistant documentation practices in your office. Record all findings, both positive and negative. Include evidence of medical decision-making unless it is clearly implied by the findings. Document treatment and follow-up, even if a wait-and-see approach is taken. Review and sign notes, reports, and letters. Leaving such documents unsigned suggests that the provider did not have a complete picture of the patient's health status at the time he or she formulated the treatment plan. Identify the patient risk factors. Make sure the current procedural terminology, CPT, and International Classification of Diseases 10, ICD-10, codes selected are consistent with the narrative documentation. Any discrepancies could make the documentation suspect. Pay special attention to prescription documentation. Refer to the list of error-prone abbreviations, symbols, and dose designations issued by the Institution for Safe Medication Practices. So always make sure that you have your abbreviations and symbols correct. Next, it says we went over voice recognition, speech recognition software. It's here in your chapter, and also it breaks down in your PowerPoint slides. Critical thinking exercise 5.1. In addition to speech recognition capabilities, what advantages does electronic documentation in an electronic health record offer over handwritten documentation in a paper chart? In addition to speech recognition capabilities, what advantages does electronic documentation in an electronic health record offer over handwritten documentation in a paper chart? So if you are looking and you're looking at this video for your 5-minute video, answer this question for an additional 50 points. This will allow me to understand and look at those who are having complications and just making sure that you all are reviewing your 5-minute video. Critical thinking exercise 5.1. Documenting remote patient provider encounters, telephone documentation. All interactions with patients, including telephone interactions, should be documented in the health record. Telehealth. Advancing technologies has changed not only the way patient encounters are documented, but also the way patients are seen by the physician. So trends and applications 5.2, use of medical scribes. A scribe's responsibilities could include assisting the provider in navigating the EHR, which is the electronic health record, entering information into the EHR as directed by the provider, history of the present illness. Remember HPI, history of present illness, review of systems, ROS, review of systems, vital signs, laboratory results, diagnostic imaging results, progress notes, care plans, medication lists. Next, as you go through your critical thinking exercises 5.2, in your opinion, are there any healthcare problems that should not be treated? Visit e-visit. Why are e-visits not recommended for new patients? Patient encounter. So make sure that you're going through all of these slides. Make sure, and it has on here, it gives you encounter info panel in SIM chart for the medical office. Remember, you always go to your info panel, patient charting, info panel. Documenting patient care within an encounter allows the user to enter all clinical information pertaining to the date of service. To create a new patient encounter in SCMO, it tells you step by step. Click the tab for the clinical care module or click on the Find Patient icon. Perform a patient search. Selecting the patient will display the patient dashboard. Click on Office Visit Info panel on the left side of the screen. It's giving you all of this information here on the left side of the screen. Specify the date and visit type in the Create New Encounter window. The specific provider may also be selected, but is not a required field. Click the Save button to add the patient encounter. Clinical documentation for that encounter can begin. Users land within the allergy record section by default, but can navigate to other sections using the record drop-down menu. After the patient encounter has been created, the medical assistant can begin to document the patient visit. Let's look at the sections of SCMO and any EHR that you would use when rooming, the patient in preparation for the provider. So it's telling you what to do here. EHR exercise 5.1, create an encounter. Complete the following exercise and EHR exercises found in the info panel. Susanna Ling, date of birth 1/2/73. Susanna Ling was entered as a new patient in Chapter 2. So you make sure you have to pay attention. So she was created in Chapter 2. Arise for her new patient appointment today. Create a new patient office visit encounter in SCMO. It's telling you each step. Click the tab for the clinical care module or click on the Find Patient icon. So when you go to Find Patient, you would put in Susanna Ling's, her name and date of birth. Perform a patient search for Susanna Ling and confirm her date of birth. Select Office Visit from the left info panel. Use today's date as the date and select New Patient Visit from the Visit Type drop-down menu. Click the Save button. So it's telling you step by step on what you would need to do to complete this. So this ends our video for Monday, March 27th. If you have any questions or concerns, please reach out to me. Remember, my office hours are Monday through Thursday, 8 a.m. to 5 p.m., Friday, 8 a.m. to 4 p.m. If you would like to schedule an appointment after my office hours, please send me an email or a text. Please do not call or text me after 5 p.m. if you have not scheduled an appointment. If you have not scheduled an appointment, please do not contact me after my business hours. So please schedule an appointment. If you would need to talk after business hours, remember, I do not respond on weekends. If it's pertaining to information, to an assignment, I will respond on Monday, and I have 24 hours to respond. Remember, I am off on weekends. Thank you. Enjoy the rest of your Monday. Bye-bye.